So welcome to the University of Calgary. I would like to take this opportunity to acknowledge the traditional territories of the people of Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The City of Calgary is also home to Métis Nation of Alberta, Region 3. In terms of emergency protocols, evacuate through the nearest fire exit, indicated by the illuminated exit signs. A first aid kit is available at the security desk. Our security staff are also trained first aid responders. Also, a third of the room are doctors. Another third specialize in disease prevention and health promotion. So hopefully we have all our bases covered. My name is Aleem Bharwani. I'm the Cummings School of Medicine Director for Public Policy and Strategic Partnerships. Welcome from the O'Brien Institute for Public Health and the Libin Cardiovascular Institute, 2 of 7 research institutes within the University of Calgary's Cummings School of Medicine. The Canada Food Guide is the single most downloaded document on the Government of Canada website. So we know people care, and we know it is a go-to document. The Food Guide matters. Google Analytics reveals a 10-fold increase in relevant food Google searches over the past 10 years. So since the last iteration of the Food Guide, already great interest has only further grown, not only in the guide, but also in food source and food impact generally, which gives wings to food policy and great power to food policy makers. Consequently, while informing policy, data used must be true. That truth must be durable, and policies and programs must not be exclusive of income, region, language, culture, and so on. But who is responsible for truth and inclusivity? Government? We often talk of government as though it's some monolith. Those guys, over there, them. But we elect governments. People vote for governments. People vote for party leaders. People donate to and inform party policy. Similarly, people work within the public systems upheld by government: public schools, public universities, public libraries, public health systems. But who sets these public institutions' policies and programs? We also do. Regular people do. Outside of government, people organize to form their own non-governmental structures. Some form civil society. Nonprofits, community associations, foundations. Others form corporations, small, medium enterprises, businesses serving individuals or businesses serving businesses. So then who actually sets public food policy? Policymakers, yes, but also an active citizenry. We are all powerful somewhere. We are all influential somehow. We're influential in our home and in our communities. What we buy, who we buy from, what companies, nonprofits, and policies we fund or support. We're influential at our work, organizing, advocating, educating, communicating for policies and programs that benefit employees or benefit our clients. We influence our policymakers through public engagements by talking to and emailing our representatives in government. We influence through entrepreneurship, entering the market with new products and new services. We influence through our academy, public institutions, and civil society in creating new knowledge, in creating new programs, and retiring old ones. We are powerful if we choose to be powerful. However, some don't have that choice. An active citizenry doesn't absolve us of wisdom, of courage. As private citizens, elected officials, or civil servants, we still bear at least the personal responsibility, if not an institutional responsibility, of inclusive citizenship. We represent the voiceless as much as we represent the forceful, the powerful, the active, or the able. Perhaps you ask, why? What does it mean to be a citizen? Yes, citizenship is about passports and birth certificates and representative taxation, but let me add 3 more characteristics. 1, citizenship is about a sense of belonging. When rich kids have healthy lunches and the rest have unhealthy lunches, an axis of exclusion is created along social class. When those same kids grow up to be sicker than their counterparts, when income and race fall along the same axis, we fracture that sense of belonging, which threatens fundamentals of nationhood. 2, citizenship acknowledges our fates are intertwined. Contaminated water and livestock here is a threat to consumers anywhere. Companies advertise unhealthy foods that doesn't just kill, but maims the eaters, raising healthcare costs, reducing economic participation, and raising everyone's taxes. 3, citizenship requires motivated action. Today we will hear stories of innovation through policy and programming in government and public sector, in civil society, and in business. The University of Calgary Cummings School of Medicine is a global citizen. We host events like today, rooted in UNESCO principles of global citizenship. We bring together policymakers, scholars, civil society, and business to explore and create health opportunities. We are not here to complain to or about one another. We are here to motivate action, grounded in notions of inclusive and responsible citizenship, whether individual, organizational, or corporate. This is quiet academic diplomacy, enabled by government, supported by government, but apart from government, which situates the academy at the creative and functional center of public, private, and policy innovation, united in one purpose: to improve the quality of life of our citizens. Today's agenda: federal and provincial perspectives on evolving food policy landscape, dimensions and limits of food marketing to children, equal access to healthy food opportunities, multi-sector health innovations, and an exploration of ripe opportunities for future innovation. Our first speaker will explore the evolving food policy landscape. Dr. Mary Labbé chairs the Department of Nutritional Sciences at the University of Toronto, where she leads a research group on food and nutrition policy for population health. Dr. Labbé is a member of several committees of the World Health Organization and is the director of the WHO Collaborating Center on Nutrition Policy for Chronic Disease Prevention. I'm told that when the Europeans needed an honest broker to facilitate food policy dialogue, they called on a trusted Canadian global citizen, Dr. Marie Labbé.
Thanks very much, Dr. Bharwani, for that wonderful introduction. And I wanted to thank the organizers for inviting me here today. It looks like a great audience who've turned out for early in the morning. What I'm going to speak to you about, as it said, and I guess I can get my first slide keyed up, is really about the policy climate and how it's changing these days, to really give you an idea of where I think some of the issues are going with policy, and to give you some background context of what's happening and what's changing. Because I think, as we heard from Dr. Bharwani in the first introductory remarks, is we really are all active citizens, and we hope by you being here shows that you really want to engage and be an active citizen. And active citizenship gives you the opportunity to help shape policy, because governments really honestly do listen to what they hear from Canadians. And I think we heard from both Dr. Hutchison and Dr. Yan last night. I mean, you know, those thousands of Canadians who wrote in, well, they do go through them all. I can speak from experience. I was there many years ago in government, and they really do look at those comments that come in from Canadians. So I encourage you to be active participants in the policy dialogues. So this is my declaration of interest. You did hear I do serve on a number of committees for the World Health Organization, as well as for the Pan American Health Organization and several in Canada, including the Heart and Stroke, and have most of the research I'll be talking about today has been funded by the Canadian Institutes of Health Research, but a number of other research organizations. So what I'm going to do today is I'm actually going to, and this is a long slide, but I'm going to walk you through what I call a policy dialogue, and really what I see is happening and how it's really changing. And I'm going to first talk about, some of the key points. We heard from Norm Campbell last night about the real focus on obesity and chronic disease, because that's where our problems, our public health problems are these days. We've solved malnutrition. That was probably the nutrition problems of the last century and the last previous centuries. And although not gone, they're not the main focus of our work, definitely in Canada today. But not only what's going on, how that's become a global effort, because I think that also enables governments to be much more active in the area when they know that this is activity that's happening at the global scene. It also enables governments to take leadership. And then there's much learnings can be seen from what's happened where other governments may have been the first off the mark and then others have pathways to follow. And as we heard today, as we're going to go into good policy, we're actually in a space nowadays where not only do governments lay policy, they have to be based on sound, really solid evidence, and that evidence has to be well documented and in the public domain. And I think we're well beyond the days of governments saying this is what's good for you and this is how we're going to handle this situation without that evidence all being out there. And what we're actually seeing, and I'm going to show you a bit more, is the policy landscape has actually changed. And I think many of our nutrition policies of, I would say, earlier years really said, how can we help the consumer to eat more healthy, to be more healthy? To now where we're seeing a policy domain where governments are actually saying, we actually need to do something to make that food environment healthier. So we're not leaving it all up to the consumer to sort of fend for themselves, but we actually have to institute policies and regulations that make it easier for that consumer to make that healthy choice. And so I'm going to show some examples of how that's going on. And we did hear a little bit in some of the talks yesterday, the fight back. And I mean, that isn't going to be a smooth ride. We know that food industry will spend some money to counteract some of the policies that they see as more aggressive. And I'll just show some examples, but I think there have been many, many successes. So I think we're in good stead where maybe we heard from New York City where there are a few things that crashed and burned, but others that have gone through. And I think we have to recognize as we do policy in this climate that our policies have to be sound, well thought of, but well consulted so that we actually do feel that governments have the backing of the citizenship as they move forward so that there's less likelihood that the sort of political lobbying can sort of put the fear tactic into governments or the political leaders and so that may put an end run around some of the policies. And I think that goes along with being transparent. That transparency really helps that process along. And then equally, as we move into the policy sphere, we have to be we have to have a monitoring and accountability, because I think nowadays we want to see not only we promise that we're going to deliver in these policies, we want to see, well, what's happened in 5 years down the road. And finally, much of that is happening at a global level, so Canada isn't alone. So as we monitor these policies, not every government is instituting the same policies, but there's a number of networks now that allow us to look at these policies more globally and see what's happening. And then at the end, I'll just pull it together and just show how that capacity is building. So why are we interested in the policy domain and around obesity and chronic disease? And this is a slide that was produced by the World Health Organization a couple of years ago, but I think it really, really shows what's happened around the world with different age groups. And there's three parts of the slide in the three colors. The blue are the communicable diseases, and that's things like maternal and prenatal conditions. That does kill people in the young ages, but once you move up into the over 30 and then the more senior, it's chronic diseases that are the cause of death around the world. And that's a totally different picture than it was 100 years ago, example. And these type of data, and this happens to be later, but these type of data were coming out in the 90s and the early 2000s. And it really led the World Health Organization to really make a big shift in the 2000s into saying, we're spending most of our money around communicable diseases, infections, maternal and infant health, and those haven't gone away, but we really weren't spending enough money on chronic diseases, and that really was holding up the development in a number of countries. So this really shows sort of, and it's a very busy slide, and I forgive you forgive me for that, but I got this also from the World Health Organization. And so what happens is concern about chronic diseases really was launched in year 2000, which was to put out a global strategy of fighting obesity and chronic diseases. And there are a number of reports that came out over the years, and if I sort of get my pointer, you can sort of see there's evolution. But what it did was evolution of both the technical reports, moving down to commitments for action, and then moving on to the later years where we actually have documents that start saying how can we monitor, what are the targets that we're going to actually strive to achieve, and then follow the results through. So it's a real progress that's happened over the last 20 years and continuing forward into the next 10 and 20 years of really saying how do we mobilize it. And I think really what's happened, which is almost incredible in the last 20 years, not only have issues around health and chronic diseases been the focus of moving into the World Health Organization, it's actually moved right up to the UN level. So we've had a number of meetings at the UN General Assembly where they have recognized how chronic diseases are actually impeding the development of a number of nations around the world. So not only do they talk about economic development, they actually say that economic development of countries is tied to how well they're doing in keeping their populations healthy. So along the way, as this focus on chronic diseases, in about 3, 4, almost 5 years ago now, 9 main targets were set up by the World Health Organization for countries to achieve in that case, it was almost 10 years away, by 2025, and they are evolving. But I put arrows on a number of them, and I think because 3 are key ones driven by diet. Others are around alcohol and physical activity, and the colored ones are actually reducing risk of chronic diseases and making sure availability of drugs. But the ones important for nutrition is to have a no increase in diabetes and obesity, and we know that those have been increasing for a number of years in countries around the world, to reduce blood pressure by 20% around the world, or 25%, and also to reduce the sodium and salt intakes of countries around the world by 30%. Those were the big targets that we had to address globally if we were going to have a hope of reducing chronic disease. And so, as I mentioned, not only did those targets come out, there actually was built in at the World Health Organization an accountability framework. And this is where governments now have to report in their figures to the World Health Organization on how they're doing at a number of points. And 2010 was considered the baseline. And so there's been reporting at a number of World Health Assemblies along the way, and that's at the top line, and also along at different years. And so a number of reports of these action plans, now governments have to report on them. And I did have a slide, and I'll put it in later, showing you how Canada was doing. And the latest Canadian report is out there, and we're actually doing fairly well. And we are reducing, our chronic diseases are actually going down, but they're still the main causes of death, as we've heard. But at least we're not increasing any longer, but they're still accounting for 70 to 80% of deaths in Canada. We are actually monitoring most things, but we are not actually monitoring those 9 key factors that were part of the targets for the World Health Organization. We are not yet doing them systematically throughout the country, but we do have stats for most of the disease outcomes, for most of the risk factors in the country. So, I did talk about, if we're going to go there, and this happens to be a committee that I'm on for the World Health Organization that's setting dietary guidelines, and I just wanted to put this down to say there's really 3 steps that's happening, and each one of these steps now have become very transparent. And so what we have are 2 in the far line here, and excuse me if I'm kind of pointing on this side, and I can't even hardly see over on that side, but basically on the your left side would be methodology. So we actually have now a handbook of how committees have to set guidelines, and it really goes detailed step by step of how guidelines are developed, how the evidence has to be collected and evaluated. And what the grade is, it actually is a very transparent process that we have to go through to say how strong is that evidence. If you're going to make recommendations, governments, but also populations, people, academics want to know, when you're making a recommendation, how strong is that evidence behind that recommendation? What are you building it on? And so that's the methodologies that we have to follow. And then the second, and I just gave, this is some examples for the sugar guidelines that came out a couple of years ago saying that countries should aim to limit the sugar intakes of their population to less than 10% of their energy intakes. Well, they were those recommendations and came out in this guidelines report on the far right-hand side. But behind that guidelines report, very publicly, there were a number of systematic reviews going through what is the evidence behind those guidelines. What were all the studies that were reviewed? What's the quality of those studies? How well were the studies done? All put together and then assembled into an evidence documents and then graded in terms of the quality of evidence. So that's the level of detail that now bodies that are setting nutrition recommendations are required to do. And then I think that helps governments when they have to implement it to know, okay, well, what was behind that guideline development? Have new studies come out since then, but at least know what the state of the evidence was when those guidelines were developed. So, if we have, and this is the case with sugar, so we now have guidelines that were set up for sugar intakes in populations. And then what happens is those guidelines end up being used in government policies. And so I'm going to walk you through and see how government policies have actually been changing and where I think more and more is going to happen. And this happens to be a set of policies around healthy eating and healthy food choices. And as I mentioned earlier, we really are seeing a shift in where government sees its role. And I would say earlier on, the policies really were on the far left-hand side of the screen, and they really were around education. So the food guide was seen as an education tool, but it also set the policies then that, for example, many of the school food programs had to follow Canada's food guide. Nursing homes had to ensure that their patients were receiving foods in line with the Canada's food guide recommendations. And then it moved on to not only the food guide, Health Canada came up with a nutrition labeling education facts campaign to say, how do you interpret that information on the nutrition? 5% is a little, 15% is a lot. So it's still focusing around the education. But then it's starting to shift to what I would call regulation. So we end up with moving from not just informing the consumers, but regulating to help them get there. So we had the first example of the nutrition facts table. That's regulated. It must appear on packages. It's standard in the regulations what it must look like. More recently, we've seen, for example, in the province of Ontario, but in many places in the U.S., where now they've mandated menu labeling. We don't have federal legislation for mandating menu labeling. I think it should come. And more recently, we've seen the front-of-pack warning labels that will appear, and we don't know what the final symbol will look like, but they will be required on food packaging. So not only have we told in the food guide how to eat healthy, now we actually have consumers the tools right on packages to help them make those healthier choices. So you can see the regulatory process is actually evolving to not just inform consumers, but to give them stronger tools. And I would like to say my recommendation is not only do we have menu labeling, we should have those warning labels, whatever the final is, on restaurant foods as well. I don't think they should be exempt from labeling. That's my plug in here for my political action piece. And then I think we have more regulations that actually are moving to improve the food environment. And I will use examples that we heard last night from Dr. Yan about the sodium reduction targets. They're not in regulations, but they start off by, first off, the Green Book was actually trans fat task force recommendation, where it actually recommended limits, and actually by regulation, limits on trans fats almost 10 years ago. And the government at the time decided not to, actually more than 10 years ago, it was 2006, I can't believe that. The government decided at that time that was probably too aggressive, but they set voluntary targets that were the same as the recommendations for the food industry to follow. That was fine, so that was monitored over a number of years, but by 2012, the federal government came up with a policy document, and you heard Dr. Yan give the results of that, that actually said these are the targets that we want the food industry to meet for almost 100 food categories. So not only are there targets that they should reduce it, they also set targets for maximum levels. In other words, food should not exceed these levels for each food group. That's a huge step forward. Now, people would say the next step forward should be those maxims should be maxims in regulation. We're not there, but we got there in trans fats. And I put the last, and I think the last, I can't read it now, but I think the last picture was the document that actually announced the regulations on trans fat, which I put in the bottom in that slide, which last year the minister actually announced that not only did we have voluntary guidelines that started in that green book more than 10 years ago, we now have regulations. You can no longer add trans fats to the food supply. So you can see that although that was a 15, 20-year evolution of policy, we've now come to where policies are actually really impacting the food environment to make it a healthier food environment and not leaving the onus just on consumers to try and fend for themselves to find healthier foods. I guess I want to explain why. And this is a slide adapted from Europe, and I've sort of changed a little bit, so I give credit to the authors who wrote it. But I'd like to explain it as all the labeling is important, and we can see the nutrition facts table on the far right-hand side, and that is what we currently have that gives consumers all the information. It has a number of very, very useful information, and we don't want to ever lose that. But it is actually hard for consumers to understand. And so as you move to the left-hand side, you get less technical information, but you get more interpretive information for the consumers. In other words, it starts simplifying that information and making it easier for consumers to understand. So things like our whatever the sign, if we don't have a stop sign, we have some kind of symbol on the front of pack to tell us these are the foods, whoa, these are the foods that are really high in sugar, sodium, or saturated fats, or some of the others like the middle, which was the Australian with the stars that gave you a rating of foods from 1 to 5. Those are really doing that interpretation for the consumer. So you're moving to a labeling system that makes it easier for the consumers to not only have the information, but to understand it and to use it. And I say that simplification process doesn't replace the other, but it really makes it easier for consumers. And that's really where labeling is going now, to provide consumers with those tools to interpret the labels. And I call that interpretive food labeling. Oops. Okay. And so this is really that transition. And I would say the first type on the left side were these facts-based labeling, which just really gives the information to consumers. And then you can see on the far right-hand side a number of types of interpretive labeling. And these are examples from a number of countries around the world and when they've been introduced. And you can see there's nothing introduced. The earliest is actually 2012, 13. And most of them are voluntary systems, but they're becoming mandatory systems. So you can see the traffic lights in Ecuador, the UK traffic lights. They've gone through a variety of versions, but that was the most recent version. You can see even grocery chains are coming out with guiding stars. Loblaws introduced their stars in 2012. Foods would have a 1 to 3 stars. The far left is Chile's regulations that were passed in 2015. And Australia and New Zealand, who have introduced a 5-star rating where every food will eventually, right now it's only a voluntary system, and of course not the unhealthy foods aren't necessarily putting the 1 or 2 stars on, but the healthy ones are putting the 4 or 5 stars on. And they hope that it may eventually, they said it'd be voluntary for 5 years, so we'll see if they make it mandatory later on. But you can see that these are all interpretive systems, and we've done some research, and really there's not a lot of difference between how consumers use one system over the other. There are slight advantages, and they can do certain things better than others. They like one better than the other, but they can't necessarily use it better than the other. But they all are big, big improvements to choose healthier foods, to really interpret that label and help consumers make healthy food choices. But I think as we go down that road, I think we have to be ready for the fight back. And I think we did hear from Norm last night that, that was in the news just not too long ago in May, that, one of the floats that came out in Twitter in the US, that NAFTA should require, basically limit the ability of Canada to introduce its front-of-pack labeling. Well, I don't think that thought just came from the president on his own. I'm sure there was some heavy-duty lobbying by there was no political comment there, but I'm sure that came from a lot of very active lobbying by the food industry behind the scenes to get that written in. And you can see that would be a trade agreement that would have a huge impact on the ability of governments to protect their citizens. And do we really want regulations where the interests of the food industry take precedence over the interest of protecting the public health of Canadian consumers? And I will be the first to say absolutely not. And if any of you have the opportunity to weigh in on that one, that's a big one where we really need to fight the ability of trade agreements to stop governments from really protecting the health of Canadians. And in the sugar drinks taxes, that's one where there's all kinds of mixed results. There's a number of cities. I think there's a map there. There's now 20 countries and 7 U.S. cities that have now introduced some form of taxes on sugary drinks. But there's been a number of what I call crash and burn. Chicago's legislation failed. So I think it's going to be a mixed bag for a while, and we'll see how that evolves. But obviously, there's been some real success made in a number of years. And I think, to say how much things have changed, back in 2013, Canada was actually one of the countries that were trying to stop Chile from introducing their front-of-pack warning symbols. So you can see that in the space of 5 years, how much this whole space has really evolved into one where we're really going down the same road ourselves now in a 5-year span. So I think that's fantastic progress. And I think there'll be many more countries going. I think that's why it's so important for Canada to be one of those first countries to get it on the map and to have a big Western, well-developed countries to have a warning label system. That will enable so many more countries around the world to follow suit. And I think that's a tremendous compliment to our government to go down that road. And anything we can do to help that out would be a tremendous asset to them. So just to put transparency as a key, and I just put a number of reports up, and I won't go through them, but this one, I had it separated out, but this little figure in the middle that you can't read is just an example of a country report that's on the World Health Organization of how we're doing. You can see the report on the lines going down, or how our various risk factors are going down. You saw the blue in the center. Those are the number of risk factors and how they're leading to chronic disease death in Canada. Norm showed those before. And I think the two things I'm going to point out on the far right-hand side of the screen is the commitment letter of the Minister of Health. I think that's a real first that we saw in Canada now, where not only does ministers always have to report to the Prime Minister what the Prime Minister expects them to get done in the next few years, it's now public. So we can actually hold our government to account and say, have you delivered on those commitments that you promised you would do in the next 4 years? And I think the other big important step forward is the transparency commitment of Health Canada. And I think if you want to go, you can go to the website, you can find it from the Health Canada website, and you can see every single lobbying meeting where the industry has come in to speak to the minister's office or government officials and said, what are they lobbying about? What documents did they bring? The copies are there. What transpired? And it's not just the food industry. If I went in there, it would be listed. If the Heart and Stroke goes in, their meetings are listed. So it's all up and publicly available. And I think it really does level the playing field, because I know when I was there, there were many, many more, delegations of industry bugging the minister's office as opposed to the public health folks in there. But at least we can see what's going on, and I think that's a huge step forward. And I'd like to see all the regulatory initiatives being subject to that level of transparency in future. And so I'm getting the wrap it up sign. So I just think with transparency that comes with monitoring, and I'm going to, for example, we have a large food database that allows us to say, well, how is the food supply changing over time? And we've got branded restaurant foods and branded packaged foods, and we've followed them since 2010. We've got pictures and nutrition information from all the foods sold in Canada. So we can see now, for example, after marketing kids goes on, we know, will the marketing on the food packages go way down? Will the foods, if we come with front of pack, will they get healthier in the next 5 years? We can monitor that. And the second and the bottom, those 3 reports, and they're actually scorecards. And we actually rated the federal government and provincial governments. And although you can't read it, they're all available on our website. You can just go Google Lab A Lab. And you can see the areas that, for example, the federal government is doing really well on, and in policy areas they're not doing so well. And I'll give you an example. Canada is doing really well on things like nutritional labeling. We've got really strong nutritional labeling. Where are we doing poorly? We have virtually no regulation requiring menu labeling in this country on restaurant foods. So those are examples where we said these are policies that are happening around the world, where government is doing well in, and where the Canadian government really could improve. And we think that might help set them examples of what they would do. We want to see the Healthy Eating Strategy version 2 come out. Well, maybe some of the areas where they're not doing so well might be areas they may want to consider for the next one. So how does this all tie together? There's a number of global networks to really say how our government's doing. And this report card of government came from a global network I'm part of, and Norm mentioned it. It's called an Informas, but it's a big network that says we're going to look at how the food supply and monitor it. And we've got a number of things, and we're looking at the food composition, labeling, and you can see a whole number of areas where we actually can monitor the food environment. And it's not just myself, we're part of the Canadian, but scientists around the world are doing that. So not only can we see how our country is at any one point in time, how it's changing over time, but we can compare ourselves to what they're doing in Australia, New Zealand, the UK, in Chile, or Mexico. So it's a really advantageous for both governments, but for public health researchers to say, this is where we're doing well in, and these are areas where we can improve in our country. And there's another one, a Milan framework for urban food policy. Toronto is part of that. It's another network of looking at food policies, and there are different sectors that are looked at, but you can see another monitoring tools. And these will all, I think, go really strongly to help improve the food environment over the time. And the last one I want to talk about is, and I know my time is just about up, but I'm sorry, I'm going to got one more thing in, is we have to talk about not only what we're doing here, we need to look at the developing world. And this is the chronic disease rates in the developing world. And they are much, much higher than they are in Canada. And they're going up and we're going down. And I'm part of a group called Resolve that's being funded by the Bloomberg Philanthropies, the Gates, and the Zuckerbergs, and working with the World Health Organization. And it's really targeting 3 areas: sodium reduction, elimination of trans fats, and hypertension reduction. And it's really to help those countries around the world so they can have the same legislative tools as that we have in North America and some of the Western world. So just to wind it up and say, policy climate is changing. I think Canada's really doing well, but I think there's much we can do. And they really are moving to making healthy choices, easier choices. And I think these policies are really being supported by a number of tools, which I highlighted earlier. So with that, I want to thank you and acknowledge the funders and a large number of collaborators who have helped us. If you want any of the information, you can look it on my website. There's a lot more details there. So thank you very much.
Thank you, Dr. Labbe. Next up is the Alberta perspective on policy plans to support healthy eating. Kenton Delisle is a registered dietitian and senior policy lead in the health and wellness promotion branch of Alberta Health, president-elect of the College of Dietitians of Alberta, and has worked to promote healthy food throughout his career. In his free time, he refines his toddler management system, talking down toddlers, getting toddlers into the house, getting toddlers out of the house, getting toddlers off of other toddlers. Ladies and gentlemen, toddler aficionado, Mr. Delisle.
Thank you. That's a very accurate introduction of what my life is. My day job is just my day job, and it doesn't take up nearly as much time as the toddler management. I'm very happy that we are here. I know that there was some very good language yesterday around the perception of bureaucrats being involved and bureaucrats telling you what to do. And this audience seems to be very well versed in understanding that bureaucrats are trying to do what we can and trying to bring things together. So thank you to the Libin Institute and O'Brien Institute and the U of C for having Alberta Health here. For the purpose of this conference, I've been asked to present on Alberta's policies and where we are now. And I can speak to this within the context of the role of Alberta Health, but with the acknowledgement that, and as we're seeing, there are many more stakeholders than Alberta Health involved in policy and the impacts of policy in Alberta. So this is one small scope of what's happening. So the plan is that we're going to have a quick overview of Alberta Health and how it relates to nutrition and food policy. Then we'll look a little closer at what we're doing in Alberta about food and food environments with regards to policy. And finally, we do hope to engage all of you in looking forward, some of the tools we use in policy analysis and development, and where we're going, and where we're hoping to go. And that's where we're seeing some of this today. How we can get there and how food nutrition policy can support Alberta and Albertans in having better access and availability to healthy food environments. And hopefully that we're enabling them to make helpful, personally relevant choices. Looking within Alberta Health, we have a very clear and simple mission of our vision of healthy Albertans in a healthy Alberta. And our mission states that the ministry ensures that Albertans receive the right healthcare services at the right time, the right place, provided by the right healthcare providers and teams. And this does not exclude organizations outside of Alberta Health. This does not exclude nonprofit organizations. This does not exclude the academics and the researchers. It actually includes all of those as being the right people and being the right health professionals. We can't live without them. Our outcomes, and the reason I bring up the vision and outcomes is that it is really directed at what we're talking about here today, in that we're looking at improved health outcomes for all Albertans. The well-being of Albertans is supported through population health initiatives directly relevant to policy work we're discussing at this conference, and from many of the efforts that we've already heard today. We do receive our healthcare in Alberta from highly skilled and healthcare providers and teams working to their full scope of practice, and this is a very important part of what we're talking about with Alberta Health and working within our institutions and how food nutrition policy can help drive improved health outcomes. And there are a number of people in this audience that are working in these institutions or support these institutions that know this better than I do. And of course, a high quality, stable, accountable, and sustainable health system. To give some framework for somebody that aren't familiar with how Alberta works, Alberta is a little bit unique in how it works within ministry and within its health service providers and within its communities and stakeholders. So Alberta Health implements the government of Alberta's direction for health and is responsible for the overall design, strategic policy, direction, legislation, and establishment of monitoring of the health system's performance. So all the really sexy stuff is from Alberta Health. In this role, the ministry ensures that the health system is delivering value in terms of health outcomes, including patient experience and investment for Albertans. Core functions include advising the minister and government on health policy, supporting policy implementation, funding the health system, and carrying out a general oversight role. So a big part of the machine within health and within any ministry is really translating the knowledge that we're getting from people here and bringing that information in as best we can to our ministry and to our government and have them understand what best practice is and what promising practice is and what may be the best options within the priorities that we have. We also have to acknowledge in Alberta we have a unique system where Alberta Health Services is the provincial health authority responsible for the delivery of the substantial, and that's an understatement, portion of the healthcare services, and really a leader in the country in many aspects of their healthcare delivery. Our business plan, I'm going to shorten my talk here. There was a lot about the business plan, but it really is that it's tying back to our business plan and showing that the outcomes we have really are directed at population health initiatives. So while we might not see the nuts and bolts of it on the ground, we might not see the nuts and bolts of it in direct policy referencing the business plan, it is there, and you will have the slide deck later where you can read that very long paragraph to yourself, or if you're having trouble on the tonight going to sleep. Outcomes and strategies, I highlight these 4 areas, being that we do work in primary prevention and wellness, which is the branch that I work in, and it generally fits in here, as we see, as fundamental elements. So engage with community partners, of course, engage with Indigenous communities and other organizations, of course, improve maternal, infant, and child health, develop and implement evidence-based environmental public health policies. So these are both directly work coming out of the ministry and like I say, in collaboration with, and again with people that we have in the audience and have already spoken and will speak some more. A lot of the people in the front rows here. So where are we now? We're supporting healthy eating as a shared responsibility, and we know that it takes more than documents and strategies, and a lot of what we present and what is encouraged for us to present is our documents and strategies. But we work collaboratively, and we do strive to foster knowledge exchange and enhance provincial and community efforts. And you heard Dr. Rain speak yesterday about meeting with ministry and meeting with government and meeting with other organizations, and we do meet regularly, and we benefit greatly from the research that groups like hers are doing in multifaceted ways. This is not by any means an exhaustive list. This is rather just to illustrate at a high level that we recognize stakeholders across the province, and we really do try and include. And I like that yesterday the municipalities were highlighted. I think that is one of the growing areas, both with New York City showing some examples, and Dr. Rain bringing that up as a focus for 2018, which is very exciting. I think that that's an opportunity for us to really look at some stronger partnerships. We would only be so lucky to all be able to crash and burn as strong as municipalities can, like we heard yesterday, where New York has the ability and the will to try things out, and we're all benefiting from the work that they're doing. Now, if we can be that lucky in our centers. So, how does this plan of outcomes and strategies fit with what's on paper and on the ground? We'll look at a few examples. Oh, by the way, I'm not with my kids the last couple of days, so you're going to just see a whole bunch of pictures of them all the way through if you haven't noticed that. We're going to look at a few examples of policy and programs and initiatives which are impacted and in many cases being built around the federal health eating strategy. and in particular Canada's Food Guide. So yes, we're moving forward, but we really do need to see how it is directly driving a lot of the work that we're doing already. So we did hear yesterday about the provincial guidelines and how they are 10 years old already, which is surprising. We were the first province to develop nutrition guidelines for facilities where children and youth are cared for, where they're taught, where they gather for recreation. So there are some things that are happening. 2 school divisions in 2008 when this was in place. It is voluntary. As of 2016, there were 38 school districts with nutrition guidelines in place. In Alberta, nutrition policy is driven by the school districts. As of 2016, I say there are 38, and we now have all 62 coming in for ANGCY, which is the Alberta Nutrition Guidelines for Children and Youth, being implemented. We also have Alberta's Regional First Nations and Inuit Health Branch using the ANGCY when working on reserve schools, and this is because they use the Alberta Education Curriculum and the ANGCY is an approved resource. We always knew that this wouldn't be an overnight success. Alberta is not a place to just flip the switch and change something, especially when it's coming from bureaucrats, that it would be a long-term thing, and we will see some of those successes, especially when we have tools like the report card coming out and showing how things are moving and evolving. We're also acutely aware that Canada's Food Guide, the new one, will result in a need, or may result. We're expecting to have some changes to update the Alberta guidelines and have an impact down the line with school districts and policies. Not only in schools, but in our adult guidelines as well, which we released a couple of years after the Children and Youth. And then, of course, Eat Smart is an example of how we implement those guidelines. So we have Alberta Nutrition Guidelines moved into a resource that's implemented in many different ways. All of these are Canada Food Guide informed. In Alberta, we have pushed a lot of nutrient-based information for our guidelines, but everything does reference Canada's Food Guide. So some examples are at a high level, and I know we've seen a lot of slides with small text, but I'm just showing that while the nutrient-based, and you'll see the messaging in this if you can or can't see it, but Canada's Food Guide is implemented at the very, very top of it, talking about food guide servings, talking about food groups. You'll see in our school facilities, that's a very small one, but look, it gets better. You can see that it's really straightforward. We had some very fortunate things with the old food guide that we have to recognize that we built policy on of having these check boxes for translating that knowledge for them. And then another example is when we look into our, a little bit, where am I at, pointing? In our childcare facilities, where again, it's Canada's Food Guide referencing, and you don't have to see, you can just trust me that those circles are referencing Canada's Food Guide very deeply embedded into it. Policy and programming in Alberta, as I've already alluded to, comes a lot from our nutrition guidelines, and a lot of it is embedded in a very strong way. So Alberta Education's school nutrition program, which was referenced yesterday, is an example of a program that uses our ANGCY. And in 2016-17, some of you may recall it was first launched as a pilot, and 14 school authorities were taking it on. What that means is they take it and they work within their school authority and decide where it's most needed and how it can be implemented. In 2017-2018, all school authorities came in on board. That's 26,000 students receiving a daily meal. And again, that is being driven by Alberta Education, but then within those school authorities itself. So it's becoming tailor-made within there, but it is money from the government of Alberta. The budget in 2018 is continuing to grow. We are seeing that it's 15 million, a little over 15 million to expand the program further. So we're going to continue to see that grow, and we will likely, as Kim said, we will see some of those grades improve, hopefully, and we'll see some outcomes long-term as those things grow. And again, I'm bringing this up showing you how we have a program, a very new program, a very successful program, and by using the guidelines, we are showing it all the way back to Canada's Food Guide. Some of you might be familiar with the historical Health EU resources we had, web-based, and this is relevant when we're looking at, Health Canada is looking at really driving things digitally, which is fantastic because we're looking at access, people are seeing it in the palms of their hands. Our Health EU website was driven by Alberta Health, and it was front-facing. That was transitioned in 2015 to Alberta Health Services and My Health Alberta. And again, really looking at how Canada's Food Guide is still driving those, being that Canada's Food Guide was embedded in our resources, that it is also embedded in Alberta Health Services and in My Health Alberta. And these are public-facing, but they're also used by community at large, primary care providers. We have a lot of our not-for-profit organizations use these as resources. Alberta Health Services builds a number of tailored web pages and sites for different groups to better understand. Nutrition policy is also foundational to institutional operations, and we can't overstate this, especially in our supportive and long-term care in hospitals. We have them being able to work from a basis of Canada's Food Guide and our nutrition guidelines, and changes will be serious in any consideration of how we're moving things forward. And questions that we've been asked consistently is, to what end would these changes of federal and provincial policies be, and will they in fact improve the food and food environments? And will they in fact support Albertans? And would they not risk marginalizing at-risk populations, or at least not any further? And these are very, very real concerns we have from our people in our province. Alberta capacity building grants, however, are an example of a multi-layered approach to supporting healthy eating environments in Alberta. And I had a discussion with a number of people this morning, and we were talking about how do we harness all these groups now becoming very creative in their dollars and what they're doing. One group can't do it, two groups can't do it, but an entire region can start to do more things. And so an example of this is with Ever Active Schools getting funding from the government of Alberta. They, among many things, they have an annual conference where they bring together different groups from school communities and organizations, and they work towards improving student health. They work towards learning outcomes. They work this through systematic approaches like comprehensive school health, and with policy being a key pillar of comprehensive school health, EverActive works with schools and school jurisdictions to use existing Alberta Health and Alberta Health Services resources to support the development and implementation of school nutrition policies. And again, back to nutrition guidelines, back to Canada's Food Guide. So we're seeing it streaming all the way down to these grants. Communities Choose Well, they award seed grants to projects, and again, looking at leveraging dollars and seeing what we're doing with different groups there, and that these small groups can do things that we could never be able to do or pilot or send out. And one example is in their goal to enable communities to take action to reduce barriers that inhibit healthy eating and active living. In Fort McKay, they use their seed grants to bring together Indigenous elders and youth in a program transferring knowledge of traditional practices of hunting, trapping, and gathering. So in one fell swoop, they brought back a cultural connection, societal connection, physical activity, and improving food environments. And they're able to do that with a very modest budget. And again, the more opportunities we can have to see those examples of strength and community-driven opportunities, we might learn to do on a bigger scale. The Alberta Healthy School Wellness Fund promotes sustainable and healthy food in the school and in the communities across the province, and it provides facilitated support and grants to schools and jurisdictions. And this approach, it enhances health and wellness among school-aged children and youth using comprehensive school health framework. And again, they're basing their healthy food and healthy eating environment work on provincial policies and guidelines. So again, reflecting on what changes may come, and these groups again saying, to what end? If we see these changes, to what end? And that's what we're trying to learn best. What do we implement? What do we move with? So where are we going now? As you can see, and this is a very clip of our food and nutrition policies and related programs, and where do we go from there? That's his bear Alfred, which used to be his partner in crime, but now his bear Alfred spends most of the day either eating us or we're eating Alfred, so it's hunting, but we have to decide on who's hunting who. So we have invested significant resources into promotion and support for healthy eating environments, as most organizations in this room have. And as such, the impacts of new federal policy, they really do have the potential to significantly impact provincial policy and operations. For better, for worse, for neutral, it is all tied together, it's all very related. We're keenly aware that it's not enough to simply educate people, and we've been hearing that, which there's finally a paradigm shift, as we heard yesterday. Where's the paradigm shift? There he is. Education alone does not translate into behavior. We know that very well, and receiving the full and finalized dietary guidance and the suite of Canada Food Guide resources, which we're all looking forward to, we'll really have to fully assess how we can apply the guidance and the policy while considering the social determinants of health as they relate to Alberta and its communities. And we'll also have to look at some of the examples of tools we use in the development of assessment and policy. So in Alberta, we use a number of tools in-house that we didn't have 10 years ago. So as many of you, that's not questions yet, sorry, I just keep playing with this. Gender bias analysis, many of you are probably familiar with the federal government being the leader in bringing gender bias analysis forward. The gender bias analysis gives us the opportunity to assess how diverse groups of women, men, gender diverse people may experience policies and programs and initiatives, and another exciting part of that is the plus. In GBA Plus, acknowledging that GBA goes beyond sex and gender, also considers many other factors like race, ethnicity, culture, religion, age, mental or physical disability, and this does enable us to have a more holistic lens considering groups and populations which may have benefits or risks from policy and what the implications might be. Alberta and Alberta Health Services have developed and used the Chronic Condition and Disease Prevention and Management framework to assess how policies and programs may or may not enable individuals, families, and communities to be as healthy as they can. So again, looking back at some of the talk that we've heard already, trying to see how can we really look at the framework and what people really do need. So this framework provides a bigger systematic analysis of policy and programs and how they may impact individuals, families, and communities. We're very lucky that we're in a time that we can have these tools that really help us give a framing and give a bit of a measurement of policies coming in and policies going out, and for us to try and check the boxes. It's hard to keep everything moving forward and considering everything. So, food policy is far-reaching. When we develop food policy, we will engage across Alberta Health and with other ministries, including agriculture and forestry, Alberta education, provincial and community stakeholders for broad perspective on how this affects how food policy affects their stakeholders, which is changing all the time. Using these assessment tools, we'll assess our subject matter experts, emerging evidence and best practice, and engaging stakeholders will continue to inform policy development at Alberta Health. And where it doesn't meet our standards, being that it is with one of our stakeholders, we'll have to adapt and enhance to ensure it is in fact supporting relevant health-enabling food policy, healthy food environments, all within the context of the social determinants of health, and how it can best serve the people of Alberta. So what else may we consider in addressing the needs of Albertans and in Canada's food guide? And be working with the stakeholders. One of the most important things, gaining buy-in, not to be underestimated in any region, especially in Alberta. And we will look to how we can disseminate and apply policy changes in our provincial work. So how can we move forward in the best way and support each other's jurisdictions and both universal and unique approaches tailored to support specific populations? We are focused on the health of the Albertan, and like we heard about New York last night, there's great initiatives that are focused on the health of people in New York. So how do we support our institutions like schools, childcare centers, and long-term care while still reaching the general public and supporting health in an equitable and dignified way? Creating environments where the healthy choice is available and relevant will come from multifaceted and joint efforts, and again, that seems to be the buzz in our conversations on the side. Simply rewriting provincial nutrition policy is not a solution. It's complicated, it's detailed, but it requires a broad vision. We don't have nearly as much work as the federal government had to put in to build their policy and are building their policy, but we do have some work ahead of us. So what do we focus on in our next steps to truly support our communities and stakeholders? And what are those steps? And I'll be looking to my partners in the province to really help us work through that. Conversations and knowledge transfer between all stakeholders, including academics, policymakers, program administrators, and non-government and community organizations, and our Indigenous stakeholders and more will continue. We all are partners in health, and Alberta Health is trying to be a cog in that. So thanks for your time.